Hello, everyone. So, the 16th of October every year is one important day and date to remember in the medical field because this is the day which is celebrated as the World Anesthesia Day or the Ether Day. So, it was in the year 1846 on this very day that the demonstration of inhalational anesthesia was successfully shown to the world, and thus the practice of modern anesthesia has started and given the shape of today's sophisticated anesthesia. Does this mean that there was no pain relief in the past? Because pain was always there for all the humans, right? Every human being suffers from pain from the origin of the humans on this earth. But how was pain relieved, and what were the methods and modes that were employed in the past or in the ancient world to relieve their pain? This is very, very interesting to know, because pain is very important part of our each and every creature's life. How is pain relief done, or how was the pain relief in the past? This is going to be really very interesting for you. Please go through each and every depiction very carefully, then you will understand the importance of pain and pain relief in the human life. Look here. The picture that you're seeing is the burial site of this great man. His name is William Thomas Green Morton. Why I am showing this tombstone is that on his tombstones there are these words that are inscripted by a person called Bigelow. The tombstone reads like this: inventor and revealer of inhalational anesthesia, before whom surgery was agony in all times, by whom the pain of surgery was averted, and since whom the science has conquered over pain. Conquering pain. See, these are so beautiful words. Nobody likes to have pain. But then how anesthesia has started? Anesthesia is a form of pain relief. A part of it is pain relief. There is so much more in detail to know about anesthesia. I am now talking about pain relief itself. So how is this been achieved in the human life? This is very interesting to know. And this happened in 1846, and he is the person who demonstrated effective pain relief with inhaling of ether in a public demonstration successfully. And thus 16th of October is celebrated as Anesthesia Day worldwide. But does it mean there was no pain relief before 1846? No, definitely there were so many various other methods, and please know all the interesting methods. The first in scripture, or the first scripture that we can see as of today, is way back to 5,000 years. A mention of pain relief by emotional methods, psychological methods, by using herbal medicines has been mentioned in the Vedas, in the Indian scriptures, that is the Atharvana Veda. So in the ancient and medieval times, how the pain relief was there after, I want to talk about after 5,000 years till later on. So this is one interesting thing which you have to know. I would like to say and point out to you, pain relief or anesthesia is so divine. Do you accept this? It is mentioned in the biblical Genesis 2:21, I think, where it's mentioned that God has put Adam to sleep and took out a small chip of his rib or the collarbone to create Eve out of that. God has put Adam to sleep. That means this was the first anesthesia ever known in the biblical history. So it means God himself is an anesthetist. Do you agree with me? So that is how anesthesia has started for the first time. And later on, the practices have been there. Humans have always been exploring options of giving pain relief to the mankind. And Sushruta, the great surgeon in the Indian history, 3,000 years back, he used to do plastic surgeries, no surgeries, surgeries over the brain and all. And he used to give some herbal concoction to put the patient to sleep and perform a surgical procedure. In the medieval times, it was a horrifying experience for anyone who had any surgical procedure or any small incision to be given on his body. 10 people used to hold a single person, and his legs used to be amputated, his fingers used to be amputated. Or there were other methods like putting leeches or blood letting out, putting leeches on your body so that they suck out the entire blood and the pus is drained out and the infection is drained out from your body. Imagine all these situations, the barbaric situations wherein 10 people used to hold, or you put in ice packs and the hands or the legs used to be amputated. This was all horrifying situations, and the surgeons was treated equal to barbers, and this procedure was called barbaric. And the skill of the surgeon was not mattering in those days. It was only the fastness of which he can amputate or proceed with a surgical procedure, like at a single shot amputate the leg or amputate something like that. So there were some other mechanisms, like they used to do extract opium from these herbal medications, herbane, cannabis, and all these herbs, and then they used to prepare concoctions to put patient to sleep. And there was an incident where the breast surgery was done by giving whiskey in the European medical field. But all these were never giving really effective pain relief. They were just used as for some minimal effect. That's it. Do you think this will give the total pain relief that we are experiencing today? No, never. And the non-drug methods that I already mentioned, holding of 10 people and then putting compressions, very tight compression bandages so that the area becomes numb and then you cut off that part, or putting leeches or insects that let out your blood, that they suck. This happens on an awake individual, or with a small concoction which just put you to sleep, but you have to suffer that agony and pain. This was horrifying, and patients used to die. People used to die, and people rather preferred to take that pain rather than go for any surgical field. So this is where the anesthesia has given beauty and grace to the surgical practices. You have to agree with me. In the 10th century, this is the more adventurous pathway in the Middle East, wherein there are scriptures and evidences of surgical instruments used in the Middle Eastern countries. This is very, very interesting to know about something called an anesthesia, which is a sponge, which is a layers of cloth wherein drops of some concoction used to be sprayed, which is applied to the patient's mouth and nose, and patient used to sleep, and then they used to perform small surgical procedures. And there is a mention in one book, Chahanama, wherein Rodaba is the patient's name. She was given some concoction, and a Zoroastrian priest has performed a cesarean section over her. But definitely there is no 100% pain relief as we experience today. So anesthesia is a boon to the medical field, and especially for the surgeons. So early in the 1800s, there was a Japanese scientist who has almost nearly given the similar type of balanced anesthesia, wherein it's not only pain relief but also little levels of unconsciousness with muscle relaxation, which is really very important for the surgeon to cut through without tightening of the muscles. Because when I cut your muscle, when you're awake, the muscle tightens, and this will not provide a very good surgical field. So he has invented something called Susan San with some herbal medications, and he improvised this beginning of this a sort of balanced anesthesia practice. So from this And the advances continued, the researches continued, and there are more and more sacrifices. I use this word sacrifices that has led to the invention or the discovery of the inhalational anesthesia of ether by demonstration in the year of 1846. So, what all happened from this early 1800 to 1846 is going to be further interesting. You must have heard about chloroform, about ether, about nitrous oxide, about what is oxygen. So, it is very, very interesting to know how the anesthesia has started in 1846 into the modern practice of anesthesia. So, get caught up and then watch my next video to follow up all this. If you like this video, please like, share, and subscribe. Thank you so much.